Welcome to Doctors on Call. I'm Jenna Miller. As of this week, there have been nearly 1 million cases of the coronavirus in the United States, leading to more than 55,000 deaths. Right here in Kansas, the numbers have gradually increased to over 3,300 cases and 120 deaths. Has the state of Kansas reached its peak in cases of COVID-19? What can you do to keep yourself and others safe? We'll get some updates and more on this episode of Doctors on Call with our guests, Paula from Russell County Health Department and family physician Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. At Blue Cross and Blue Shield of Kansas, we're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Paula received her associates in nursing in 1990 from Kansas Wesleyan in Salina and worked at Asbury Salina Regional Medical Center, now known as Salina Regional Health Center, on the ICU step-down unit and then transferred to the labor and delivery unit. In 2002, Paula started as the administrator for the Russell County Health Department and health officer for Russell County. She obtained her BSN in 2013 from Fort Hays State University and will graduate with a doctorate in nursing practice from Fort Hays State University in May. Dr. Tyrel Summers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding the coronavirus on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or nurse. Let's go ahead and get started with some of our questions while we wait for those phone calls to come in. Let's first talk about the coronavirus. We were talking about it a couple weeks ago. Has it reached its peak yet, in your opinion, in Kansas?
As we're looking at the numbers currently that have been released by the Kansas Department of Health, it looks as if the numbers are starting to go on a very, very minimal decline. Now, it's again impossible for us to fully tell if we're at a peak or not. And if they are at a peak, it might be just the start of like a very brief peak that's there. It could be that this is just kind of a slowing down during the season where we're kind of going into the summer months. And it might be starting to kind of ramp up or even get worse in the fall. It's hard to say. Again, we're just kind of studying the epidemiology of it, watching those numbers as we see kind of the community instance either decrease or increase. We'll just kind of have to keep a close eye on it.
How does a person differentiate if they have the flu or if they possibly have coronavirus?
That is something, it's really quite difficult anymore because CDC keeps adding more and more, symptoms to the category. But the biggest thing is if you still have a fever, shortness of breath, you have that cough that just can't go away. You feel body aches and tired.
Why is it that some people are getting sicker than others? Some are completely asymptomatic. They don't get any symptoms at all. Why is that?
Yeah. We've had a lot of people that get kind of a myriad of different symptoms with the coronavirus. The biggest thing that we've noticed is individuals that have very severe chronic illnesses or those that are immunocompromised are the ones that are getting sick by far. Also, the individuals that have like underlying comorbidities like heart disease or diabetes or even really bad controlled blood pressure or heart failure end up getting more sick than individuals that are just regular healthy individuals. For the most part, individuals that are underneath 40 tend to be asymptomatic carriers unless they have some type of underlying chronic illness that's causing difficulty.
Are you aware of any options there are for Kansas families that are in need of child care? We've got children that are at home now, parents still need to work. What kind of advice do you have for that?
KDHE did give some exceptions that certain providers can go over, like 1 or 2 children temporarily to help ease the stress of parents trying to work through this. What they need to do is just call Child Care Aware and they can get a list of providers in the area.
Now we're at the point where we see a lot of people that are masked. Some states are saying that everybody has to be, whether or not they go out. That can be very irritating. Do you have any suggestions on how to deal with those face masks?
Yeah, so wearing a face mask, whether that be a paper face mask, whether that be one that's made of cloth, can be very, very irritating, especially around the areas kind of in the nair where it rests against. The biggest thing that I would tell individuals if they're wearing cloth masks is to make sure that when they're laundering the masks, that they, if they use bleach or they use something to sanitize, that they're also using something that's a very like unscented or very non-harsh kind of detergent, and then to make sure to rinse it maybe once or maybe even twice to kind of get out as much of the soap and the bleach as possible, because if you get that, it can cause a little bit of a contact irritant to the surface of the skin. So you want to really be safe and be careful with that. Now the paper ones, they can be kind of irritative, especially if they pull around the ears very tight. So I've seen some individuals that make a like a clasp that will hold the earpieces together and kind of take some of the edge off of the ear and then also some of the pressure off of the face. That would be completely acceptable as well to use.
Okay, we might talk a little bit more about this in a moment, but right now we've got a phone call waiting to be answered. This is Sondra on the line from Smith Center. Hello, Sondra. Go ahead with your question for our guest tonight.
Yes, my question is kind of twofold. You hear that in order to be able to fight off disease, that you have to, in some way be exposed. And so I'm wondering, with everyone having to stay at home or wearing masks, how we can actually, be exposed to be able to fight that off. And then secondly, kind of like, when do we go back to just having to figure out how to live life, not having to, when does it get to the point where we just have to kind of go on with life as we know it and figure out how to live with this virus?
Absolutely, Sondra. That's a wonderful question. Thank you for that. There's two different things that we want to address when talking about that. The first thing that you're talking about is what scientists and what doctors refer to as herd immunity. Basically, what that means is that if we can get enough individuals that are exposed to an illness, we can get kind of a whole group of individuals kind of immune from it, for lack of a better term. We use the same kind of principle when we vaccinate, actually. We try to get a large number of people, around 80% or more of a population vaccinated, so that we can reduce the incidence of the disease happening. If we can also get about 80% of the individuals infected with the disease, we can also attain that kind of immunity, which is a good thing. That reduces the spread and reduces the likelihood of it further occurring. The reason coronavirus is a little bit different is because of the rate of infectivity. If you look at the rate of infectivity of coronavirus, it's extremely high, meaning that individuals can pass it extremely quickly and can even pass it without even knowing that they have symptoms. That's kind of why we've made such a big deal about kind of isolating ourselves, making sure that we're staying away and trying to avoid herd immunity. Because what can end up happening is if one individual gives the disease to 5 or 6 individuals and 2 or 3 of those are immunocompromised, then they pass it on and they pass it on. There'll be a large influx of patients that come into the hospitals and that can overrun our hospital system. If that were to occur, the precious things that they would need, like a ventilator or oxygen, might be stripped from the hospitals as resources, and they may not be able to give them to the patients that need them. And that's why we've made such a big push as public health advocates to make sure that we're limiting the number of people that are exposed. It's not that we don't want people to get the disease. Actually, in all honesty, we do want people to get coronavirus. We just want to make sure that we do that in a slow, controlled manner where we can help with kind of limiting the amount of taxation it's going to cause on the health system. Now, to answer your second half of your question, when do we go back to life as normal? I want nothing more than to go back to life as normal. I really do. And I hope that that's sometime soon. Unfortunately, as it is right now, what we have to do as doctors and what we have to do as epidemiologists is we have to look and see how the spread of disease is occurring week to week, day to day, and to see those numbers. We have to be able to see a significant drop-off in the number of cases that are occurring while not seeing new cases coming in or seeing new rates of hospitalization. Once we start seeing those trends kind of go down, we can start reopening things and kind of phasing in our way back to life as before. It's not going to be an all-at-once thing. It's going to take time. It's going to take steps as we kind of come back to what new normal will be. And even then, when all this is said and done, our new normal may not be what it was before. We might still be using a lot more precautions when it comes to cleaning our hands, when it comes to keeping distance from individuals, and when it comes to kind of just taking care of ourselves overall.
Okay, we're going to go back to the phone lines. We've got Jerry on the line from Russell. Hello, Jerry. Go ahead with your question for our guest tonight.
Here's Doc plasma from another town, another hospital, another state. My blood type, just in case I get the virus.
So, Jerry, I believe what you're asking about, is about like plasma-rich kind of proteins. of individuals who've been infected with the virus, and if it's been shown to be effective in reducing spread, or at least in treating individuals that have had the virus. That's very much true. We are using those type of technologies and those types of resources of individuals who've been infected and that have antibodies and different proteins to help kind of fight the infection, and have shown really good success with that in kind of areas where it's been inundated, where there's been a lot of viral spread. Now, in Kansas as it stands, we're not doing any treatments for individuals that are not actively infected or that are hospitalized. And so it's not really a good preventative treatment at this point. We're just kind of holding and reserving back that kind of treatment for individuals that are severe or critical within the hospital.
Okay, we were talking before the phone calls a little bit about face masks. How necessary do you think, especially in our area, how necessary do you think it is to go out and be wearing a face mask?
It kind of depends on the person itself. Some people are very, very anxious when they go out and they feel more secure if they did have that face mask on. Please, if you do, go ahead and wear that face mask if it makes you feel better. When you wear a face mask, you're not protecting yourself from somebody else. You're protecting that person from getting any disease that you may have. So that's how that works. As far as in our area out here, if it's close contact and stuff, I highly encourage people to wear a mask. I mean, if you go outside to go for a walk, you wouldn't need to do that.
You hear a lot about the lack of availability of face masks. So people are reusing them. What is your advice on reusing a face mask?
Well, the paper mask, it just depends on the mask. They're usually good for maybe 1 or 2 times. A lot of people are wearing the fabric mask now, and those are pretty decent. They hold up pretty well.
Would you recommend more testing for coronavirus in Kansas?
So we're doing a really good job so far as testing is concerned, at least within Russell County, where Paula and I both kind of keep tabs on the number of tests that are there. I definitely advocate that we need to continue testing pretty aggressively in areas where we haven't seen as large of a spread of coronavirus. And the reason why is just like I was explaining earlier, as we see more and more cases either increase or decrease, that can affect what we do as public health agents and can kind of determine what we're going to do as far as opening back businesses, as far as scaling back businesses. It really kind of helps us know. So I advocate testing, especially for individuals that meet the criteria that's been released by the Kansas Department of Health.
Who qualifies for a test?
Anybody, there's actually 3 different categories right now. If you have traveled out of the country and you return and you have even just 2 symptoms, and the symptoms now, like I said, have expanded so much. It's not just the fever, the cough, and the shortness of breath. It could be the tiredness, the body aches, sometimes even the nausea and vomiting. If you travel to areas that have a high level of community spread, and that means the virus has passed through the community and they can't trace it back to the person that gave it to them, and you show symptoms, then you can be tested too.
And are there enough tests available right now?
As it stands right now, we do have enough tests within the state of Kansas for testing. We continue to replenish. We continue to get more and more tests. We've utilized multiple different laboratories in order to get this taken care of, both in the public health sector as well as in the private health sector, so that we can make sure that individuals that need to be tested for coronavirus can be tested.
And is the test still the nasal swab? Is that how we test?
Currently, yes.
Okay. And what about a saliva sample? Are they doing that?
So they've tested kind of in some different remote spots the possibility of collecting saliva samples rather than nasopharyngeal swabs. The deep nasopharyngeal swab seems to be the best way at this point to test. It gives us the highest rate of getting detection in PCR testing, which is what we use, and so we're still recommending deep nasal swabs at this time.
Can you explain what contact tracing is?
Contact tracing is where the health department actually comes in, and we talk to the individual that has tested positive, and we find out who he has been in contact with at least closer than 6 feet for longer than 10 minutes, 2 days prior to showing symptoms up until when he was deemed positive. And then we go back and we contact all those people, and they actually have to stay in quarantine for 14 days to see if they get sick.
So if a person is thinking they might have it, do they need to go to the hospital first, or do they need to go to the health department first?
Neither. They need to call the physician's clinic first and
Okay.
let them know. We don't want them just to show up, because if they are positive, they're exposing anybody that they come in contact with there.
Excellent. Good idea. Now, do you think the new antibody test will provide any answers?
It's a great question. It's kind of early in the phases in rolling out kind of the IgG, IgM antibody testing. What it basically is looking to see if individuals have active antibodies against the coronavirus specifically, and whether those antibodies are new or old or kind of informed. At this point, I think it's going to be good, but it's hard to say without getting more kind of tests and seeing more and more individuals that have been tested. But I have good hope that it will be something that will at least let us know if someone has seen coronavirus and if they were just asymptomatic or very minimally symptomatic and would be immune to it from there on forward.
What is herd immunity?
So I kind of addressed a little bit about what herd immunity was earlier with our caller Sondra when she asked that question. What basically herd immunity is we're trying to get a good percentage of a population that can kind of become immune to a disease to help reduce the spread of that disease to other members of that population. If you look at kind of how vaccinations work, we vaccinate as many people as possible, trying to get at least that magic 80% number of individuals that are vaccinated, and that will reduce the spread to those that are immunocompromised or those that can't get the vaccine because of some type of intolerance or allergy to the vaccine.
Okay, excellent information. We're going to go to the phone lines now. We've got Oliver on the line from Concordia. Hi, Oliver. Go ahead with your question for our guests.
Can mosquitoes or ticks spread the virus?
That's a good question. I don't think there's been enough studies done to actually come up with a definitive answer yet. That is an excellent question, and I'm sure they're going to be studying that as time goes on through the summer here.
And what about, I think the last time we were on, we were talking about animals, it being spread to animals. Is there any more updates about that?
So the only case that we have of a known animal vector was that tiger that was tested in New York City back when we had talked a couple weeks ago. We haven't seen any more animal vectors specifically that have been linked to it. There was, again, kind of the initial phase where we thought it was related to a coronavirus that was from a bat vector. But again, that isn't 100%. There was some link, but for us to say definitively that was the case, we just can't do that. That's too early at this point.
And what extra precautions can be taken for those people who are helping with the elderly or those with maybe pre-existing conditions?
The biggest thing for the people that are taking care of those people, biggest thing is to make sure you wash your hands. Sometimes just the hand sanitizer is not alone. I'm old school. I prefer if my people walked over to the sink and used soap and water. Now, if that's not available, then use the hand sanitizer. Also, try to take care of yourself. If you are ill, don't go to work. You're going to make those people susceptible to whatever you may have.
What are your thoughts as far as nursing homes and long-term care facilities? Should they have more testing? Should they be providing more testing right now?
Yeah, so if you look at guidance that's been provided by both the Centers for Disease Control and the Kansas Department of Health, they do recommend that individuals that are at high risk, especially those that are in nursing home, are tested much more aggressively compared to the general population, just because of the risk factors that it would mean to that nursing home to specifically have someone tested positive for coronavirus. We've also taken other measures in local nursing homes within the Russell County region where we're basically not allowing any visitation. Any individual that comes in, whether it be an employee, whether it be really anybody that brings supplies into a nursing home, is screened and made sure that they don't have any signs of any underlying coronavirus infection to reduce the spread to the nursing home residents and to assisted living residents. I would advise anybody that called and contacted me about kind of precautions and things to do those types of same things for any kind of individual that would be at high risk for having coronavirus, to make sure that they're asking individuals that come into their home or asking for people that are doing things for them to make sure that they're not having any kind of symptoms or any kind of problems, and limiting the amount of time that they're out and away from their home where they could get any kind of spread of coronavirus.
And how long can you have the virus before it actually shows a positive test?
Coronavirus actually has a 2 to 14 days.
Incubation.
Thank you. Incubation period. Typically what we've seen is people usually start getting sick about a week after they've been exposed to somebody else that has coronavirus.
Okay, we're going to go back to the phone lines. We've got Janice on the line from Stockton. Hi, Janice. Go ahead with your question. You are live on the air.
Yes, I was wondering if there had been any studies or if the nurse and doctor have any opinions about loading up on maybe some extra vitamin C as far as fighting off the coronavirus or boosting our immune systems.
Sure. So vitamin C has long been touted as kind of an antiviral type of replacement that some individuals like to take to help reduce their chance for any kind of viral illness. If you look at the actual studies that show different doses and people who took vitamin C compared to people that didn't, those studies have shown that it really did not show a conclusive benefit to being on vitamin C, and the same thing would hold true for coronavirus. Now, with that being said, does that mean that you shouldn't take vitamin C? No, that doesn't mean. If you feel more comfortable and feel more confident in taking vitamin C and think that it helps reduce your chances of receiving infection or getting infection, that's completely safe and okay to do as long as you're taking it as recommended by the manufacturer of your vitamin C supplement.
Excellent. How do you feel the community has been doing as far as the social distancing guidelines in our
I feel our community has been doing excellent. They maintain their distance. People that they don't go out like they used to, which is really quite sad for our businesses. I really feel bad for our businesses, and I'm hoping things can get turned around a little bit so where they can get everybody back into the workforce. But as a whole, I think our community has responded very well.
And have the self-quarantine recommendations changed?
No, the self-quarantine recommendations have pretty much remained the same since our initial kind of guidelines were provided for us at the beginning of March. We're still very much asking individuals that are at high risk for quarantining at least the 14 days that we talked about with that incubation period that can be seen with coronavirus to help reduce the spread of the infection. Now, that can be changed, that can be kind of differentiated based upon testing if an individual is tested. But again, that's very specific to the individual, and that all depends upon what symptoms they're exhibiting. So that would have to be in coordination with the physician in order to kind of change that.
Now, Janice was asking about vitamin C. What about foods? Are there any particular foods that can help boost your immunity?
You can go.
Yeah, I'll take that one. So when you look at immunity in regards to just your overall health, the biggest thing is just making sure to keep a balanced diet, making sure that you're eating foods that are kind of rich in multiple nutrients, multiple vitamins, and making sure that you're eating good, wholesome food to begin with. The other thing that's very beneficial to help reduce any kind of infectious rate is to make sure that you're staying active as best as you can. Now, of course, if you get coronavirus, we don't want you out walking, we don't want you out spreading, we want you to try to minimize it as best as possible. But just making sure that you're getting good sleep, making sure that you're eating a good, healthy, balanced diet, and making sure that you're getting good exercise is all very good advice anytime, let alone when you're sick.
Now, if someone has recovered from the coronavirus, are they able to catch it again?
They're doing studies to find out if they develop an antibiotic system to be able to fight it off again. You know, some similar like when we get chickenpox and things like that. I don't think they've said specifically if if they do develop an immunity or not. I do know they are studying it.
Dr. Will elective procedures start taking place again soon?
So the American College of Surgeons actually released a document just the other day in regards to when elective surgeries can begin for certain hospitals, and that guidance can be found on the website for the American College of Surgeons. Basically how it ends up being is as we continue to roll in and kind of phase in different areas of business, we'll be able to start seeing some elective surgeries coming back. Again, I caution and I warn people that this is not going to be anything that's going to be drastic or that's going to be immediate. It's going to take time. It's going to take a little bit of some space and some figuring out as we kind of go through this. But yes, we will start to see individuals that want to have elective surgeries, that need to have their elective surgeries for different reasons, start to be able to get some of those services. And that really depends upon the number of cases that we're seeing of coronavirus and how active it is in the community as a whole by that facility. And they'll evaluate that as time progresses.
Now, is it safe right now to continue bringing in mail and packages?
Yes, those are still very safe. Actually, by the time the mail you receive the mail, be it the mail service, UPS or whatever, transport system, the virus, if there was on there, has already died. It's already.
Okay. And do you believe, Doctor, this pandemic will promote and increase more telemedicine appointments?
I sure hope so. I've really enjoyed the aspect of telemedicine that I've been able to deliver to my patients and really think that it's a good service that we should be utilizing more as kind of a medical community. Now, is it the be-all, end-all when it comes to medicine? No, it's not. But it definitely does have a place and should be utilized a lot more. I think in individuals that are sick and that want to avoid kind of spread or that want to minimize their chance of bringing it out to the community, it's a great option.
And what are some of the CDC guidelines to start opening up this country?
They're going to actually start it in phases, and the federal government has said, started in phases and then passed it down to each governor in the state. We did have a call this afternoon that we talked about, and they are going to start in phases. We have not got the guidelines yet from the state. Hopefully we'll have those by Thursday.
Now, do you believe there will be a second wave of this virus come fall and winter?
I think we both Paula and I, we've talked, we both believe that there's a second phase that will likely come with this virus, and that we're going to have to really closely watch and see kind of how we kind of uptick as a population. If we see a massive number of cases, we might have to do this very similar social distancing, a stay-at-home order, whatever it takes to help reduce that spread if we do see that in the fall.
Okay, we just have a few seconds left, Paula. Give the audience a little bit of advice of how to stop the spread of this virus.
The biggest thing you can do is make sure you wash your hands, take care of yourself. If you're sick, you stay home. Cover your mouth when you cough, sneeze, anything like that.
Excellent. Well, thank you both so much for being our guests tonight on Doctors on Call. That's Dr. Tyrel Summers from Russell Regional Hospital and Paula Bitter from the Russell County Health Department. Be sure to stay safe and stay healthy. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. At Blue Cross and Blue Shield of Kansas, we're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.